Well, thank you very much for arranging this slot for the brain imaging session in the conference, and I'm so grateful to Itamar and Tim for agreeing to talk. So my small and short presentation is really linking very much to what Timo has already talked about using clinical memory clinic data in imaging research that will help us actually provide very tangible translation into clinical practice. So will help us with better diagnosis and better prognosis for our patients. So I wanted to show you, just by taking a step back from the analysis and machine learning protocols, to see what happens at the sort of clinical level in the memory clinic. So I work in a memory clinic in Northwest Sussex, as well as in Centre for Dementia Studies. I have no commercial disclosures. Just very briefly, I wanted to show you, for those of you who perhaps do not work in clinical practice, what the pathway in a memory, just typical memory clinic looks like. And I appreciate that it may look differently in different places, but basically our patients go through the referral, and they go through this assessment process that involves different steps up to the point of sort of us reaching that diagnosis and having the diagnostic and prognostic discussion with the patients and putting in place management plan. An integral part of the process, a very important one, is brain imaging that takes place as part of the pathway. And in our clinic, probably about 50% of patients are referred for an MRI scan. Others may already have some scan, some brain imaging done before, or can have a CT brain scan. And for those people who we would like to request an MRI scan for, we offer them coming to our Clinical Imaging Sciences Centre. So that is an imaging centre based at the Falmer campus at the University of Sussex. So this is a research site that also provides clinical service for memory clinics and other services. And I think Professor Critchley mentioned that in the one of the first talks yesterday morning. So when we see people from our memory clinic in the Clinical Imaging Sciences Centre, we often also involve them or offer them participation in research. And the current projects that we're involved with include the QMIN-MC study that Tim just talked about. So what are the clinical benefits of having a scan at a research centre? For our patients, they are very, very practical points, I think, to consider. So first of all, people may have the scan quite promptly, and we know from our clinical experience that this may vary in different parts of the country, and having a scan is actually one of the bottlenecks in the assessment pathway. So people who have a CISC scan have the high quality clinical scan that is usually reported by a consultant neuroradiologist with expertise in neurodegeneration. And these scans are also uploaded to the general hospital system. So for example, if there is a need to discuss them with other specialists like neurologists or neuroradiologists, these images are available, and it is relatively easy to have them discussed at MDTs and make onwards referrals if appropriate from clinical purposes. From the practical side of things as well, again, in contrast with some hospital-based centres, people can get to the department and park just outside, and they can either drive themselves, so we brought by a family member, or we can arrange hospital transport. So that's quite a lot of the kind of convenience. And I will just leave this slide with some quotes from from the feedback survey from patients who attend the scan at SISC. So you can see that they are quite appreciative about the level of service they experience at SISC. So they feel it's all done, it's well organized, promptly. It's quite a quiet environment compared to most hospital departments. So what I wanted to just say a few words about our contribution in Sussex, in Sussex Partnership specifically, to the QMIN study that Tim talked about. We've so far recruited 27 participants, but we sort of getting up to speed, and we hope that there will be many more very soon. And I just wanted to acknowledge here my two excellent colleagues, Tammy Epperson and Elise Armsby. Tammy is now on maternity leave, but Elise is the clinical research coordinator, mainly working on the QMIN study, and she's been brilliant and excellent in helping us get organized, talk to patients, and and discuss informed consent. So just going back to my previous scan, what I wanted to say that just sort of linked to Tim's presentation before, that the reason why we want to continue with imaging research and we want to involve patients from local memory clinics in that is that we're hoping that these studies will lead to an improved diagnosis and prognosis, and that we can use it in order to give better information for the patients. And I will echo Tim's comments about, us working as clinicians, that one of the most frequent questions we come across is from the patients and from their families is, what is going to happen? What can I expect in a year's time, in 3 years' time? And one of these important questions, I think, particularly for us working in dementia services, is not just about whether my memory problems will develop into dementia or how quickly I will deteriorate, but also what is going to happen with regards to other symptoms, like, for example, neuropsychiatric symptoms. And we know that there is a potential for brain imaging to provide some answers relating specifically to the risks of developing different neuropsychiatric symptoms. I'm not going to spend time at all talking about this particular studies, which is the research based on the cohort that was initially scanned at SISC when Dennis Chan set up the scanning protocol, and it looked at the correlation between the risk of developing various neuropsychiatric symptoms and changes in brain structure, and also in connectivity of the brain. And we actually have found that there is some positive, that there is correlation between loss of grey matter volume in particular areas, and they can correlate with the risk of developing particular neuropsychiatric symptoms. And similarly, we did find this correlation also with neuropsychiatric symptoms and changes in the connectivity in various functional brain networks. So this is not something that has been assessed with machine learning protocols, but this is just an illustration, as other studies done before that there is this potential to use brain imaging into developing protocols to answer these prognostic questions that can actually be quite nuanced, and hopefully will improve our care for patients in the future. So I'll just leave you with the final comments. I very much think that whilst it may sound very, very sort of technical and sciencey, this is research that actually can have a real tangible clinical impact and translation. And it certainly is important for this research to be performed on the basis of real life clinical cohorts, just like patients in our memory clinic. We also think that this involvement of people who come to memory clinic and then have a scan in centers such as SISC will give us opportunity to test other new technologies, such as, for example, low field MRI that was mentioned, by Hugo Critchley yesterday, and I'm very much hoping that Itamar can lead on that. And then finally, we hope that the artificial intelligence, machine learning, will help us make the most of this real-life clinical data investigations, including scans, and perhaps in the future include some other modalities and elements, such as, for example, blood-based biomarkers. So basically what I'm trying to say is that using the technology that we've got already, which is widely available, relatively inexpensive, like MRI scans, can actually help us answer a lot of detailed and nuanced questions relating to patient care. Thank you.
Gosia, thank you very much. That's great. And
just wanted to acknowledge at the end, sorry, my colleagues, especially my clinical colleagues in the memory assessment team, who are wonderful and have been referring people to QMIN-MC studies, particularly Natalie, Antoine, and Faye Fuggle. So I'd like to thank them and everybody else at CISC and Dementia Research Unit.